Have you ever taken a common pill without realizing it could raise your risk of dementia? It's a reality many seniors don't hear about, that certain medications often prescribed to older adults may actually increase the risk of memory loss and cognitive decline. These aren't rare, exotic drugs. They're medications millions of people use every day, sometimes without knowing the hidden dangers. If you're over 60, this is especially important. Knowing which pills to watch out for could help protect your memory and independence. In this video, we'll cover 4 types of medications neurologists warn can contribute to dementia in seniors. We'll explain how they affect the brain, why they're so common, and what alternatives you can discuss with your doctor. This isn't about fear, it's about facts, research, and real-life experiences. Stay with me until the end, because you'll also learn practical tips for talking to your healthcare provider so you can protect your brain for years to come. 1. Anticholinergic medications. One of the most common and concerning categories is anticholinergic medications. These are often prescribed for allergies, bladder problems, sleep issues, and some digestive problems. On the surface, they seem harmless, they relieve symptoms like a runny nose, overactive bladder, or insomnia. But they work by blocking a brain chemical called acetylcholine, which is essential for memory, learning, and overall brain function. When acetylcholine is blocked, even temporarily, it can cause confusion, forgetfulness, and difficulty concentrating. For younger people, that might be a short-term side effect. But in older adults, especially those already at risk, long-term use has been strongly linked to faster cognitive decline and a higher risk of dementia. The real problem? Many seniors take several medications with anticholinergic effects, without realizing it. Over time, these effects add up. Example: Eleanor, a 74-year-old from Ohio, had chronic allergies and frequent nighttime bathroom trips. Her doctor prescribed an antihistamine and a bladder medication, both with anticholinergic effects. She started becoming more forgetful and confused, assuming it was just aging. After reviewing her medications with a pharmacist, she learned the pills might be to blame. With her doctor's guidance, she switched to safer options and regained mental clarity. These drugs are not only in prescriptions, they're in many over-the-counter cold, allergy, and sleep medications. And just because something is sold without a prescription doesn't mean it's risk-free, especially for people over 60 or 70. The takeaway: review all your medications regularly with a healthcare provider. Ask, does this affect memory? Are there safer alternatives? Sometimes, a lower dose, a different drug, or a non-drug approach can provide relief without hurting brain health. Sleep aids and sedatives. Another group neurologists often warn about is sleep aids and sedatives, including benzodiazepines. These are prescribed for insomnia, anxiety, or restlessness, problems that can become more common with age. They work by slowing brain activity and calming the nervous system. While they can help you sleep, the brain needs natural sleep cycles to keep memory and thinking sharp. Long-term use has been linked to confusion, memory loss, and a higher chance of developing dementia. Example: Henry, a 78-year-old retired accountant, started taking a benzodiazepine for sleep. At first, it worked great, but months later, he became forgetful and easily disoriented. His family urged him to talk to his doctor. Together, they slowly reduced the medication and tried non-drug sleep strategies. Over time, Henry's mental clarity improved. Older adults also metabolize these drugs more slowly, meaning they stay in the system longer. This raises the risk of side effects like dizziness and falls, which can cause even more health problems. If you use sleep aids regularly, talk to your doctor about alternatives. Simple changes, like reducing screen time before bed, adjusting meal times, or practicing relaxation techniques, can sometimes help just as much. 3. Certain antidepressants. Some older generation antidepressants, especially tricyclic antidepressants, have been linked to higher dementia risk when used long-term. These medications change the balance of brain chemicals like serotonin and norepinephrine, improving mood but sometimes causing memory problems, confusion, or slower thinking. In seniors, these effects can be mistaken for normal aging, when in fact the medication may be playing a role. Example: Linda, a 69-year-old retired nurse, began taking a tricyclic antidepressant after her husband passed away. Over the years, her forgetfulness grew worse. A new doctor reviewed her medications and suggested switching to a newer antidepressant with fewer cognitive side effects. Over time, Linda's mental clarity returned. Tricyclic antidepressants are sometimes still prescribed because they're effective and affordable, but for older adults, the risks should be weighed carefully. Never stop an antidepressant suddenly, but do discuss safer options with your healthcare provider. Point 4. Over-the-counter PM pain relievers. Many nighttime pain relievers, the ones labeled PM, contain diphenhydramine or other sedating antihistamines. These are the same types of drugs found in some allergy and cold medications. While they can help with sleep and pain, they also slow brain activity and, over time, can dull memory and thinking. Example: Joe, a 75-year-old retired mechanic, used PM pain relievers for arthritis and occasional insomnia. Over time, his family noticed he was forgetting appointments and getting lost in familiar places. His doctor linked the symptoms to regular diphenhydramine use. Once Joe switched to other pain relief options, his mental clarity improved. The danger here is that people often assume over-the-counter means safe, but for older adults, these sedating ingredients can quietly affect brain health, especially with frequent use. Always read labels, and if you take PM pain relievers often, ask your doctor about other ways to manage pain or sleep. Final thoughts. The 4 types of pills we've talked about are: anticholinergic medications, sleep aids and sedatives, certain older antidepressants, PM pain relievers with sedating antihistamines. The goal isn't to scare you, it's to help you make informed choices. If you or someone you love takes these medications, talk with a healthcare provider about the potential risks and safer alternatives. Medication management is a team effort, and your voice matters. Many times, a balance can be found between treating symptoms and protecting brain health. You deserve to feel well and think clearly. And with the right approach, both are possible. If you learned something new today, like, share, and subscribe for more health tips to keep your mind and body strong as you age.